Howdy doody, guys. I am back. We're going to talk about the knee. Whoop, whoop. Remember that song, Head, Shoulders, Knees, and Toes? Well, we'll eventually get to the toes. But right now, we're talking about the knees, okay? Identify the three bones that make up the knee. I'll give you two: femur and tibia. What's the other one? Let me give you a little hint. It starts with a P. It's little, and it is a sesamoid bone or a floating bone. Give up? Don't know what it is? It is your patella. Your patella are one of the three bones that make up the hinge joint, similar to your elbow hinge joint, but this time we're addressing the knee. Okay, it is what's unique about this particular situation is that you have two joints here. You have your tibiofemoral joint, which of course that is the hinge joint that makes up the femur tibia and your patella, and your patellofemoral joint, which anytime the knee flexes and extends, the patella glides up and down the femur. Okay, so that's what makes this knee unique. It kind of covers two joints, but just know that like the elbow, it is a hinge joint. Okay, and we talked about where does the patella glide when it flexes and extends. It goes up and down the femur. Okay. All right, and I just said it. Sesamoid bone or your patella bone is a floating bone because it slides in the groove of the front of the femur. Okay, it attaches at the quadricep tendon to basically give a home to the quadricep muscles. Okay, and it attaches to the front of the tibia by way of the patellar tendon. So we talked about what we will talk about how many muscles are in the quadricep. Here's a guess, or take a guess. What does that mean? That kind of gives you the answer of how many muscles make up the quadricep. Four. Okay. The easiest way to remember these four muscles is that you got vastus that covers 3 out of 4 muscles: medialis, lateralis, and intermedius. Okay, for as far as your quadricep muscles, and last but not least, your rectus femoris. All right, it is good to again, I won't go deep into it, but it's good to originate yourself with the location of these 4 muscles responsible for knee extension, located on the front side of the leg. Okay. Now, how many muscles are in the hamstrings, back of the leg, that flexes the knee? You have your biceps femoris, you have your semimembranosus, and you have your semitendinosus. All right, those good old hamstrings. Here's a little tip. If you want to really work your glutes, definitely engage your leg into some hamstring workouts. Don't overload your quadriceps. Building strong hamstrings is ideal to building wonderful glutes. That's just a little trainer note for you. Okay, so it's important to acclimate yourself of knee flexion and knee extension, important muscles as far as movement of the knee is concerned. All right, so we have additional muscles that help to support the knee as well on the posterior and the middle and the outside or medial or lateral side. Okay, they do aid in abduction and adduction. Okay, you have your gastrocnemius muscle, which is responsible for the that nice muscle that pops out as we point our toe. Okay, and those are also responsible for knee flexion. All right, going to the most important part are the ligaments. Okay, I want you to let me see as we scroll down onto the questions. How many ligaments are in the knee? Okay, right here, this gives you the answer. Medial collateral, lateral collateral, anterior cruciate, and posterior cruciate. All right, so they do exactly what they say, and they are exactly located exactly what the terms indicate. Okay, medial being located on the middle or more so on the inside, lateral, of course, covering the outside, anterior covering the front, and posterior covering the back to help stabilize the knee. All right. So question, what's the difference between collateral and cruciate? Without going into too many details, collateral is a little bit more superficial, while cruciate is a little deeper. And that's really the more obvious difference between the two. Okay. So without getting too difficult or too deep into it, just know that it's just a matter of location of where they are in terms of protecting the knee. All right, so we'll go into our next question in a second. Okay, just know you have menisci, which are basically serve as cushions between the femur and the tibia to prevent from bone rubbing. Okay, just prevents wear and tear, and they help keep the knee stable. And of course, you may have heard of meniscus tear or menisci tear, and we'll get into that a little bit later. And you'll notice, like every part of the body so far, it's got bursa. Okay, so same thing. If pressure is applied to those bursa, again, that's an issue of possible wear and tear, or maybe equipment might be too tight, or maybe you're in an occupation that puts a lot of strain on that particular part of the body, causing bursa to fill with fluid, and that's where again you have bursitis that were to occur. All right, so common knee injuries, of course, you got a sprain, which is just a ligamentous issue, and where it talks about the most common ligamentous injury to the knee, that's one question above the last one, ACL. Okay, very common, partly because of its location. All right, meniscus tears injured while rotational forces and planted foot position. So just imagine being twisted to one side while your foot is planted in another direction. So, and that will cause your knee to lock up. I've seen that on the gym floor, and from what I was told, as far as the description goes, it's like you are not able to move. It is excruciating. Okay, to prevent knee injuries. Now, the interesting thing about our knee injuries is that if we don't properly train them, they can go bad on us very quickly. So it's so important to protect those knees through neuromuscular training, proper technique, and proper biomechanics, preventative knee braces if needed, and you want to strengthen the muscle. So that means your quadriceps, your hamstrings, your gastrocnemius muscle, all of the muscles that help to flex and extend the knee and help with a little bit of abduction and adduction. Very important. Okay. We talked about chondromalacia is, okay, improper tracking of the knee. Improper tracking of the knee. All right. So it's very important to just ensure that you maintain flexibility for the most part in the knees with this particular injury. All right. So, of course, like anything, you can dislocate it. You want to immobilize it anytime there is dislocation, and deformity can be seen. And the only person that can reduce it is a physician. Epiphyseal plate fractures, we talked about epiphyseal being kind of serving as a growth plate. And this is something that just to be mindful of in terms of your younger athlete. Refer them to the physician and making sure that you're not giving them any type of treatment modalities that inhibits their growth. Still the same concept. All right, patellar tendonitis, same thing, inflammation of the tendons in the patella. You'll discover that most of these injuries in the knee are overuse. Okay. Then you have tendinosis, which is similar. It's just a tendon condition where the tendons start to degenerate or break down. So still maintaining flexibility. Certain concepts like jumper's knee are things to be mindful of in terms of patellar tendonitis. Ice is needed. Always ice is needed. Okay. So because patellar tendonitis is found in jumping sports. So just name one sport that might cause some jumping. I have one: basketball. Okay, that is one sport just to be mindful of in terms of jumping and patellar tendonitis. All right. Additional injuries seen in younger athletes, especially those who run and jump. Okay. There might be pain and swelling and tenderness. A lot of times if treatment modalities do not inhibit growth for the student or for your younger athlete, these conditions can improve on their own, but just making sure that you're not participating in any activity that may inhibit their growth and as far as recovery is concerned in their bones. Okay. Now, direct blow right to the knee, patellar tendon rupture. Okay. It can look out of place just by the athletic trainer's eye, and surgery is necessary here. Okay, you have your ACL ligament sprain, similar to what we talked about with different sprains. It can be graded. Okay, you could hear it and it can pop. So it does take a little while, 6 months to return, especially if it is surgical. So making sure that your athlete has the right padding on to protect their knees, but not only just the athlete, but if you're playing volleyball or if you are rollerblading or if you are biking, things of that nature that require you to protect your kneecap. Anybody can think of any other activity or sport? I'm actually to see if you guys watch this video. Tell me any other sport that you could think of that might require some padding to protect your knees. All right. So ACL is not just the only ligament that can injure. You can injure actually all four, but of course your ACL being the most common. You have your PCL that you can injure as well. Same thing. There you might hear a pop. Okay. And generally with PCL injuries, rehabilitation is ideal. MCL, you can basically get a blow that kind of forces on one side of the knee, either side of the knee rather. And at this point, you might need to treat with the method of prices. All right. Additional knee injuries. We've all heard of IT band syndrome, and there's pain on the outside or the lateral part of the knee. Our favorite thing to do is to foam roll. Okay. We all know what foam rolling is, right? Yep, we sure do. Again, another activity to see if you are watching these videos. Take a picture, screenshot, and send me a picture of a foam roller. Oh, I'll be waiting. All right. In summary, similar to your elbow, your knee is a hinge joint with only moving in certain directions. Okay. A lot of these knee injuries are stem from overuse and just maybe improper protection, especially those that may be experiencing a patellar blow. So just be mindful of the questions that were provided to you so it can help you remember different facts of the knee. Peace.